is a procedure that is performed to assess abnormal cells on a pap smear. When we perform pap smears, we use this brush that is put into the vagina via speculum, and we rotate it a few times in the cervical canal and get abnormal cells or normal cells, whatever cells are there, put them into this bottle. It's called liquid-based cytology or LBC. And this sample goes to the lab. A pathologist would look, or special machine nowadays will assess the sample and we'll get a result. The result may come back as normal or abnormal. Abnormality may have different stages. It could be CIN1 or low-grade abnormality, or CIN2 or 3 high-grade abnormality, or cancer. However, cancer we generally can see with our eyes, and we'll probably do a different test such as a biopsy for cancer. So once we receive the result of this test, and the result shows that there are abnormal cells, usually low-grade changes or high-grade changes, we would proceed to a procedure called colposcopy. Why do we need to do colposcopy? Because pap smears miss about 30% of abnormalities. They only pick up 70% of abnormalities. And if there is a deeper lesion or deeper abnormal cells, we will not be able to pick them up with the pap smear, and we will proceed with the colposcopy. Colposcopy is performed with a big microscope type of device that is used to visualize cervix, and we would see a picture like this, looking at the cervix, or basically in there. And this is cervical opening, and this is our cervix. We would then apply acetic acid or vinegar to this area, which would highlight abnormal cells, and they would look white. We would then apply iodine solution, which would once again leave abnormal cells in a white color and color normal cells into the brown color. This area that has abnormality or abnormal cells would then be biopsied. Biopsy is not painful, colposcopy is not painful. To avoid bleeding, we would apply a bit of silver nitrate to the area, and that would be it. This procedure is quick, it takes about 10 minutes. There is some aftercare, such as avoiding sexual intercourse for a couple of days. You may have some spotting or brownish discharge for several days. We would then get the result of biopsy, which would once again tell us how severe abnormality is, and depending on the severity, we would decide on the treatment, which in some cases would be no treatment at all, just an observation, a repeat pap smear in 6 to 12 months, and in other cases would be a LETS procedure, which is also a small procedure performed in the office, most likely under local anesthesia.